Guys, there's three things that Medicare really will never cover. And we're going to talk about that on today's show. It's interesting because a lot of people come into Medicare thinking, well, everything's just going to be paid for. And while Medicare is really great coverage, there are some things it doesn't cover really at all. And so in today's episode, we are going to be talking about that. Welcome to Medicare School Daily. We're so excited to be here with you today. We have a new guest on the show. This is Justin Cohen. He's an agent, one of our Medicare guides here at MedicareSchool.com, and just one of my favorite people that works for us because he is not only a little bit funny, but he takes incredible care of our customers, and we just get amazing feedback. He knows more about Medicare than me, and so that's why he's on the show in my dad's absence. And anyway, so welcome to the show. Glad to have you here.
Thanks for having me.
Yeah. So guys, we're gonna get to some callers. We're gonna answer some questions. The format of the show is gonna be as it is every day. We'll do some education. We'll take some calls. Remember, this show is going to transition off of our main Medicare School YouTube channel here shortly. So I need you to go to MedicareSchoolDaily.com. That's MedicareSchoolDaily.com. There's a YouTube icon on there. Click on it, and it's gonna load up the new channel that you could subscribe to, new YouTube channel. Subscribing, of course, is free. If you're listening to us on one of the podcast apps, Apple Podcasts or Spotify or wherever, welcome. We are glad to have you here. If you want to be a part of today's show or any show in the future, we're on every day from 11 a.m. Central Time to noon, Monday through Thursday, and we would love to talk to you. We get smarter when we hear from you. Right? We love to know what's going on out in the Medicare world. We learn from you guys, and then it's also an opportunity to talk to us about your questions. I think maybe the most interesting thing is most people that you are going to talk to about Medicare are either kind of slightly uninformed, misinformed, they're friends, neighbors, they're trying to collect information, great intentions, but they don't understand the whole scope. So that's one type. The second type is people who are trying to sell you something. Right? You're on a phone call with someone, you have an agent that you go to their office or they come to your home and they're trying to sell you a plan. This is your opportunity on Medicare School Daily to call in and talk to people who've been helping people with literally tens of thousands of people, helping people with Medicare for a decade and a half in a non-sales environment, right? We're not going to try to sell you anything on a live show. We're just going to talk to you, answer your questions, and hopefully help you. So take advantage of that opportunity. The phone number to call in is 833-824-2004, 833-824-2004 if you want to be on the show. If you do need immediate help, that would be comparing Medicare Advantage plans, Medicare Supplement plans, getting quotes for Plan G, Plan N, drug plans, all of these things. You can call our office and schedule an appointment at 833-833-3661, 833-833-3661. Before we hop into the education, let's take our first call. We've got Mary from Pennsylvania ready to chat to us. Hello, Mary. Are you there?
Yes. Hello.
Hi. Welcome to Medicare School Daily. What's your question today?
Yeah, I'm a retired postal worker, and so I have Postal Service health benefits. And, of course, they started with the Postal Service health benefits January of 2025. They went away from the regular FEHB. So I turned 65 this month, so I have 3 more months to decide what to do, whether to go on original Medicare or to continue with my Postal Service health benefits. And
okay, when do you turn 65?
This month. I already turned on April 4th, so I have 3 more months to decide. So the time I retired, I did not have to take Medicare. Now, pretty much everybody now, when they retired, are required to. But I was going to go on regular Medicare anyway. So my concern is whether to stick with my Postal Service health benefits as my supplement or to go on a regular supplement plan. The Postal Service health benefits, basically, okay, you do the original Medicare, and the only thing they really waive is your deductible. And the out-of-pocket, it looks like it would be $13,000 per year.
That's the out-of-pocket? Yeah, the max or whatever.
Right. Now, they have an Advantage plan part of it, which you get the $100 a month back.
Okay.
And they do have perks. I already have like an eye plan and a dental plan on my own because my husband's on it.
Okay.
So I'm not concerned about that. They do, reading into it, it seems like the deductible for your drugs, the 600 and some per year, they seem to, there isn't a deductible for us. It seems too good to be true. There's some other perks to it. My concern is like the cost, because especially the Postal Service is having problems now.
Yeah.
So are we going to stay in business? And the plan I'm on is pretty much nationwide, but with doctors and stuff. And it sounds like as long as they're in Medicare, like a supplement plan, you're allowed to go in and out of network. Like I said, it sounds too good to be true, the one I'm on. I haven't had that aha moment of like, okay, yes, this is what I need to do.
Sure. Well, just one quick question. Do you have A and B set up?
No, I didn't do that yet. Because my concern is, okay, since I have 3 more months to do this, if I waited till, let's see, April, May, June, July 1st, and then at July 1st B date, I would have I would have 6 months from there, and that would go to the open enrollment of the Postal Service benefits, and I could see like maybe what's going on and decide whether, okay, no, it seems like they're changing too much. There's too many things happening. They're taking too many things away, whatever. And then I could just decide there then, just to go on a supplement plan. Mm-hmm. So it would give me space to decide exactly what I should do.
Yeah. Hi, Mary. This is Justin. It sounds like you know something about this Medicare business already. Would you say? You've been watching our videos?
Well, I've been watching Medicare for like, I don't know, probably like 2 years now, because my husband had to go on Medicare last year. He turned 65.
Oh, good.
So, yeah, it's just confusing. And even back then, it's kind of, I had to make a quick decision. He just went on original Medicare and a supplement plan. I took him off my Postal Service plan.
Sure.
Because there's just too many concerning things.
Does he have like Plan G or Plan N or something like that?
He does have a Plan G, and I do have a question about that because we got a notice about it going up.
Yeah.
So I do want to ask about that too. But like I said, with me, I don't know what to do with the Postal Service health benefits for me, whether I should just totally ditch it, because once I ditch it, it's gone. But I'm concerned because to get any kind of benefit, because I'm concerned about that $13,000 out-of-pocket thing if you just take the regular medical thing and don't do the Advantage part of the postal benefits. Mm-hmm. But then I don't really like the idea of the Advantage plans at all.
Okay. Yep. You do know something about this. So when faced with the choice between a supplement plan and an Advantage plan, you yourself would gravitate toward a supplement plan, much like your husband chose, maybe a Plan G like that. And that's because you like the freedom to be able to go to any provider. You want to avoid pre-authorizations. Don't let me put words in your mouth, but it sounds like you've got a plan in place, and that is to try this postal thing for a bit. You're going to postpone the start of your Medicare a couple months because you can. That'll give you 6 months to start a Medicare supplement plan, still with home medical underwriting. You'll get to try one out and then still have a chance to go on what you know deep in your heart that you want, which is original Medicare and a supplement plan. Talk to one of our guides to work out the details, but I think that you're on the right track there.
Can I ask a quick question? What's the difference between this? I hear you say something about a $13,000 max out of pocket and then an Advantage plan.
Right. Well, they have like, say I wasn't going to go on Medicare at all,
okay,
and I was just going to stay with my Postal Service health benefits, because I do have the opportunity to do that because I retired before that rule that you have to have original Medicare in order to keep the plan.
Okay, so you literally can't. You don't even have to go on Medicare, is what you're saying.
Technically, I don't.
Okay,
and when they started, they did offer the people who had retired years and years before, they were allowed to come into original Medicare.
Sure. Okay.
And they paid all the penalties.
But
they decided to do that.
That sounds like a terrible option, right? I mean, for you to not go on Medicare, the $13,000 maximum, so we could throw that option away. Is that correct?
So the only way to not have the maximum out of pocket. Let me bring this chart thing up I had. Yeah. Okay. So yeah, in order not to have the $13,000 out of pocket for the year, is to do the Medicare Advantage with the Postal Service Health Benefits Plan.
Yeah.
So I could keep my plan and not do the Medicare Advantage, but like I said, I'm stuck with that $13,000.
Yeah. Okay. So I think we could throw that option away. So then the question is, do you want to have this Postal Service Medicare Advantage plan, or do you want to do the original Medicare with a supplement? It sounds like you're a fan of supplements. You put your husband on one. You understand there's differences between supplements and advantage plans as it relates to pre-authorizations, your doctor kind of getting to really have the final say-so as opposed to an insurance company saying, nah, you can't get that. I mean, you sound, like Justin said, I feel like you have a pretty solid plan of what you want to do. So what blanks can we fill in here?
Okay, so then we got this letter the other day from his supplement plan company, and it's going up. It's going up $43 plus, or $46 plus a month. Okay. Mm-hmm. Okay, and to me that's a 33%.
That's a big increase. What carrier?
This is Aflac.
Yeah. Okay.
And that's what I'm saying. If this is going to happen every year,
no, it's not going.
Let's say within our state and the type of plan we have. So it sounds like everybody who has an Aflac plan is going to increase, whether it's that much or not. I don't know.
Sure.
But yeah, so if that was going to happen every year, that is unsustainable.
For sure, yeah. So can I give you a little bit of history on that? So for probably 15 or 20 years, Medicare supplements went up 2, 3, 4, 5%, like pretty much inflation. Just kind of like kept pace with it. That was all normal, standard. The last, I would say, 2 years, and I think this third year is what everyone's saying is going to be the final year. I can't promise you that. But, post-COVID utilization, I don't know if you look at healthcare stocks or anything like this, it's called the medical loss ratio. The amount of people using and the healthcare inflation has gone up so much. I mean, it's kind of got rampantly out of control. And so Medicare supplements that for years, like probably our number one carrier, for 20 years in a row, they had a less than 3% rate increase, right? And now the last 2 years, and it seems like this final year is what hopefully everyone's saying, we're seeing double-digit rate increases, 20%, right? And that's happening across the board. That's happening with group insurance. There's health insurance plans leaving markets. It's been quite the upheaval as it relates to insurance for about the last 24 months. They're saying this year maybe it's all going to kind of be normalized as it relates to supplement plans, and we hope. But I don't want you to have this idea that, oh, golly, every year it's going to go up 30%. I don't want you to expect that. I don't think it's going to happen. So we've been doing this for since about 2011 now, and never experienced anything like this. The market is trying to normalize right now. The insurance companies are, as it relates to supplement plans, are generally they're just bleeding money, and so they're having to equalize these premiums to the point where it kind of keeps up with this healthcare inflation that's all happened since COVID.
Sure. So but I guess I could. We got the supplement plan through you guys.
Yep. Please, how's your husband's health? lately?
He doesn't have any problems.
Oh,
so,
good. Here's what you need to do. Call into us. Let me give you the phone number. You have a pen, or maybe you already have it?
Yeah.
Okay, it's 833-833-3661. Tell them, just call in and say, hey, current client, got a notice of Aflac going up, need to rate shop. And here's what you should consider. In Pennsylvania, there's no excess charge, right?
Right.
You ought to look at a plan in. Like I would when you shop that. I mean, you could look at Plan G. There's probably some cost savings, I would assume, that's available. But ask them about Plan N. Are you familiar with those differences?
Yes.
Yeah. I mean, you're going to pick up a minimal copay. $20 up to $20 to see a doctor. Up to $50 for an emergency room. But that's very minimal, and lots of times there's pretty significant cost savings. And because Pennsylvania doesn't have excess charge, we recommend, Justin, I think Plan N's kind of the go-to in Pennsylvania.
Plan N's a great option.
Yeah.
Just the price difference between G and N, consider how many doctor's visits there might be. One will generally save you more money than the other, but they're both great plans. You should really consider both there, Mary, especially if your husband's in great health. We can change his carrier while he's healthy and for as long as we need to. We can remedy that.
Yeah, and just so you know, there's not like a financial incentive for us to like switch you plans. We just want to help you guys save as much money as you can. So,
right.
Yeah. So call in. Let's do that. As far as yourself, do you need to enroll in A and B? It sounds like, and you want to do that in July.
July's the last month.
May, June, July. Yeah, July would be my last month.
So then her Part B effective date would be
August 1st.
August 1st, and then what would be her kind of drop dead date to enroll in a supplement plan?
She gets 6 months from the date the Part B starts. So we count for it. August is the first month. August, September, October, November, December, January. So January 31st, Mary, is your last day to be able to get a supplement plan without answering any health questions.
Okay.
Mm-hmm. You can try the Postal Service coverage in the meantime, combined with your Medicare A and B. And I understand your concern about the volatility of the cost of the supplement plans, but I've got concerns about the volatility of the cost of the Postal Service coverage too.
Well, yeah, like I said, there's more and more out there about post office having financial problems, which they always do anyway. Right. But it just seems to be every day getting some kind of a notice, about the problems. It's just starting to worry me. Right. And I didn't like the fact in the first place that it went from FCHB to their own PSHB anyway. That worried me from the beginning.
Yeah, now you're kind of being forced into an Advantage plan. So, yeah.
Exactly. And that seems to be like through all the plans that are offered, and to get anywhere a better money-wise for the plan, you have to do their Advantage version, because everything else, to not do an Advantage, the out-of-pockets are, there's one that's $15,000, $13,000,
yeah,
$12,000.
Yeah, don't do that. Yeah, I mean, you want to use. I feel like you're going to get a lot of insurance for joining Medicare for sure. So I wouldn't not do the Medicare part. Okay, do you have a plan? You're going to call in. Let's see if we can save you some money on Plan G versus Plan N, or switch carriers on Plan G. And then it sounds like enroll in July for an August 1st Medicare date, right? Mm-hmm. And then by January 31st, you need to make application for a Medicare supplement. Let me give you one little tip. Don't try to do your Medicare supplement plan before December 7th if you're going to delay this, right? And the reason for that is everything's going to be so busy. The insurance companies get backed up. Everything takes forever to process. You wait on hold, all this stuff. But you're going to hear all this stuff about, there's a deadline, December 7th, I got to get my coverage in place. That doesn't apply to you, okay? That's different. That applies to your husband if he wants to switch his drug plan, right? That's it. But
yeah, we did that last year. We switched the drug plan.
Yeah, but my suggestion would be wait until December 8th. and then kind of move forward.
You know what? I'm going to be flat on my back on December 8th. Make it the 9th or 10th.
Yeah,
for
9th
me,
or 10th. Yeah, give us a couple days.
One comment about the supplemental increase notice. The other day on your live show, you had a 75-year-old lady
Yep.
who was retired this year, and I was just surprised that you come up with, I think it was like $152 for a supplement plan. So I'm thinking, okay.
What are you paying right now?
His right now is $138.86.
Okay.
And it's going up to $185.23.
Okay. Let me see. Let me see if I can pull up. I don't have my computer here with me right at the moment. I want to see if I can just give me a second. If I can pull up a little quote. I don't think it's just call in. Okay, call into our office. Tell them you're a current client. Need to get in touch. Shop your options, and they have everything I have. I can't log in at the moment. So get you all the quotes. Okay.
So that sounds okay about the way I planned on doing it. I can wait and try the post office plan and have no problems if I wanted to the original Medicare and supplement. So that sounded like a good plan.
Yes, it does. I don't see any problems with it. You might reach out to us instead of waiting until the last part of December, January. Talk to us in December, middle of the month. Also, if anything happens while you're on the Postal Service coverage in the meantime, you can give us a call and just say, hey, I got this bill. Is this right? Should it be this way? Yeah, give it a spin. But eventually we'll probably bring you over to a supplement plan G, and there you'll stay.
Or a plan in.
Yeah, right now we go to the doctor, so we don't really pretty healthy.
Yeah. Well, it was nice chatting with you. Thanks for calling in. Thanks for letting us help you. It's always a pleasure to talk to one of our clients. So thank you for letting us serve as your broker. We do appreciate it.
Thanks, Mary.
All right, thank you.
Take care.
Both of you have a great.
Bye-bye.
Bye-bye.
All right, bye-bye.
Hello, Flo. How are you?
Good.
Good. I understand you have an earnings test question. Is that right?
Yes.
Okay. Tell us what your question is, and we'll do our best to help you sort through it.
Well, I had just this week I had applied to start my Social Security benefit in July, and I work supplemental now. But I was just wondering because we have that $24,480 that you can make in a year. So when you're starting to take your benefits for that year, is that for the whole year on the year you take your benefits, or is that start like you just got to keep under the amount of the $2,040 on the month you start taking your benefits?
Go ahead.
Flo, what's your age currently?
63, but I'll be 64 in June.
Okay, turning 64 in June. And you just signed up to start taking Social Security in July, so you'll be 64 at that time, and you're working to supplement your income. And so you just want to make sure that you stay below $24,480 in income from your job over the course of that year. And if you feel like you're going to go over, you want to notify the Social Security Administration ahead of time. Do you think you're going to have trouble staying under that amount?
Well, so the year you, because when I was listening to your show, so the year you start, does the income you make up until you start count on that 24,000?
No, they're going to look. The year you start, they'll actually look forward, and so they'll take that and they'll look at a monthly amount, right? So you'll need to stay under.
So in July, then.
Yep.
I would just have to keep around the 2,000 mark in July.
Exactly, and that going forward.
Yeah,
Yep.
I mean, I
but
can
then
do it.
next
I only
year,
work supplemental.
Yeah, but then next year, right? I need you to, they're going to look at that full 24,480 over the course of the full 12 months.
Mm-hmm.
Okay.
Yeah, so I think you have the right understanding of it.
Okay, so now I don't need to worry how much I make up until the end of June. I
Right.
just got to watch what I make from July, and the rest of the month I should try to just stay around that 2,000 mark.
Yeah, stay under
Correct.
that.
Yes.
Yep, and that's like your not your you take home, but the max, like what you earn
Your
before
gross.
taxes and stuff, right?
Yes.
Yep, your gross.
Yep.
Okay.
Yep. And it's
Because I'm
way.
just trying to figure out, because I pick up shifts, and if I know how many hours I can pick up, I can just stay under that. So
Yes. Yes. Sounds like you've got a good plan. What are you? What are you doing for your health coverage in the meantime?
well, my husband is
Okay.
still working, so we
Okay.
have our insurance under
Good.
his, and then I'll probably apply for Medicare next year or when I turn 65.
Well,
But
yes.
then I'll be like looking into more what your things are for when we do that.
Now, what? Yeah, absolutely. One thing I was going to say. So, since you are going to be on Social Security, right? You are going to be automatically enrolled in Medicare A and B, and you'll get what you said. Your birthday's in
July.
July,
June.
in June.
June.
Okay, so then
Yeah.
your Medicare card would come. When is that? This is May, April, March,
June,
end of
5.
February. Yeah, probably towards the end of February, you'll automatically get your Medicare A and B card.
And you'll have to make a decision. Do I let them put me on Medicare, or do I want to stay on my husband's group coverage? So you want to talk to us about that. We'll help you compare and make the best decision, okay?
So when should I call about that? When I...
About the time the Medicare card arrives in the mail.
Yeah, just wait till your card
Oh,
shows
okay.
up. Yeah, perfect timing.
Okay, and then call.
Yeah, because you may.
Then even though they send it to you, you don't have to take it.
That's right.
Okay.
That's right.
Yeah.
We'll encourage you to
I'm a
take it
nurse,
if it's
and one of
better.
my patients told me about you guys, so he
okay.
told me to study up on you guys, so that's what I'm doing.
Well, thank you. We appreciate it. We appreciate it. Tell your friends. We'd love to help. We obviously do a lot of education online and workshops and all sorts of stuff. But we do have a team that can help you walk through your individual situation and compare
Okay.
what does it look like if you stay on your husband's employer coverage. What's the cost going to be of a monthly cost? What's the max out of pocket deductible? All of this stuff. And then just compare that to what's available on Medicare, right? And then set those two side by
Okay.
side. And if it makes more sense to stay on the employer coverage, then we'll just tell you to do that, because we know once he retires, then you'll call and we'll help you at that point with Medicare.
Okay.
So, okay, what other questions you got?
Well, that was it for now. I'm just, because it's all new, and I'm like hoping I'm making the right decisions, but I've been praying about it. So, but it's just, yeah.
We have.
I retired a year and a half ago, and I've been working, but I have a pretty stressful job as a nurse, a bedside nurse. So it's. And,
that's a lot.
And I'm just
that's one of the hardest jobs. That's for sure.
God bless you, Flo.
So I'm like, I think I'm ready. I wasn't ready to retire a year and a half when I retired from my job, but I went back supplemental knowing I was going to do that, because I'm just trying to help my children with babysitting and stuff. But, now it's like, it's just more stressful, and that gets me more tired. Now I'm like, I think I'm ready to cut down on hours. So I've done nothing but work with people who are retiring for 16, 17 years now. And it seems like you watch people, and when they know, it's time to go. It's time to be done. It's time to be done.
Yes.
Okie dokie. Thanks. Nice to chat with you.
Yep, thank
If
you
you
for
need
taking the
anything
time.
else, call in. We'd love to help. Thanks.
Thanks, Flo.
okay, thank you.
Bye-bye.
Bye.
Okay, guys, so there's 3 things that Medicare never going to cover. Justin, let's talk about the first one. Let's talk about foreign travel and how does Medicare work if you're on vacation or not in the country.
Yes, foreign travel emergency. So Medicare is great because it works pretty much everywhere within the United States, but not really anywhere outside. There's limited coverage near the U.S. border, but don't expect them to understand or take Medicare in Thailand. So you need to prepare yourself. You can get a traveler's policy from American Express or from the Traveler's Insurance Company. Marvin recommends these. I think they're worthy of your consideration. But whether or not you get one of those, Medicare does have a provision, not Medicare itself, but your Medicare supplement plan or your Medicare Advantage plan have a provision to reimburse you for those foreign travel expenses, foreign travel emergency medical expenses that you incur within the first 60 days of that travel. So make sure to keep a receipt and bring it back and bring it to us.
Okay, so let's talk through scenarios. So first off, 60 days. So if you were traveling, they're saying like if you're somewhere longer than 60 days, you're not really traveling. You've like kind of moved there for a little bit, right? So let's also differentiate. Original Medicare A and B covers nothing outside of the U.S. And then I guess probably like Virgin Islands and some of these
Guam,
other, like Puerto Rico, Samoa, all those. But outside of those, so U.S. and its territories, original Medicare is not going to do anything.
Nothing.
Your Medicare supplement plan, if you have a Plan G or a Plan N, has a limited benefit. And so has to be within 60 days of your, I guess, exiting the U.S. or whatever.
Of the U.S.
Let's talk through like the financial. Let's say they had $100,000 worth of bills that was incurred in Germany or some other country. What's that? How's that all going to flesh out?
Sure. Well, first of all, that would be a lot.
Okay.
For another country. We're numb to it here.
Yeah, that's true.
But no, if it's maybe $10,000, maybe $20,000, whatever it is, you're going to get some sort of a receipt, and you're going to have to make payment, and you're going to have to find a way to make it home.
Okay.
Back to the United States. But once here, we'll help you file a claim with your Medicare supplement carrier. And what they're going to do is they're going to reimburse you 80% of the cost you incurred, less a $250 deductible, up to a lifetime maximum of $50,000.
Okay. So let's say you had a $10,000 bill. You had to pay it, put on a credit card, whatever, get back, submit the receipt. We can help you do this if you're a client of ours. And the way that would work out is the supplement plan would probably pay you $8,000 in reimbursement, less the $250 deductible, so you'd end up with $7,750 perhaps.
That's right.
And you paid your 20% plus the deductible, $2,250.
And then you'd take your next vacation to a different country.
Different country, yeah. And if you had an issue there, let's say it was another $10,000 bill, right? It would work the same way. Will the Medicare supplement pay up to a maximum $50,000 over your lifetime?
Over your whole lifetime.
Okay, sounds good. Do you know how it works for Advantage plans?
Those will reimburse you usually everything except for like $90 or the copay of your emergency room visit.
Is this maybe the one time where an Advantage plan is maybe better than a supplement?
Maybe one time. Yeah, that's right. In fact, there's talks of there are actually some Advantage plans that are being accepted in places like Panama, if you can believe it. It's relatively new, but expats are talking about it on YouTube. Okay. So maybe outside of the United States, Advantage plans, maybe put the advantage in Advantage plans.
Maybe we found it.
Right, but if you're sticking stateside.
Yeah, that's funny. Okay. That's one thing. Second thing that Medicare does not cover is custodial long-term care.
Yes.
So let's speak to that a little bit.
So first we want to separate that from something like skilled nursing. Okay. People think of skilled nursing and long-term care and confuse them, but skilled nursing is inpatient rehab. This happens a lot after a fall or a broken hip. Somebody needs to be getting rehabilitation at an inpatient setting. That's called a skilled nursing facility. Medicare pays up to 100 days for these types of facilities. If you're on original Medicare and a supplement, if you're on an Advantage plan, you can expect about 20 days of skilled nursing to be paid for before you're going to be discharged. Medicare does cover this. The skilled nursing facility.
But it's post-medical things that happen.
That's right. Okay. The purpose of...
Not like dementia, Alzheimer's.
No. Okay. This skilled nursing is for people who are being rehabilitated so that they can go back home to their independence.
Okay.
But at a certain point, if a doctor or provider makes the determination that this person is never going to live alone by themselves again, then that's not skilled nursing anymore. That's long-term care.
Okay.
And it's one of the things Medicare doesn't cover. They'll pay
Which
for
could be really expensive.
Oh,
Like 10,000 a month, 12,000
now.
a month. I know that cost has just gone. And we see these, I guess traditionally maybe called a nursing home. Maybe they're, called long-term care facility or whatever. There's a bunch of different names for them now. I think we all know what we're talking about. But Medicare's not going to cover that. So your options to get that covered, right, is have the assets to pay for it, have some sort of a long-term care policy, which has, those are very rarely, I think, purchased anymore. I think a lot of people will do what they call like an asset-based long-term care, where you put money into something like an annuity, and it has this big, huge benefit for long-term care if you ever needed it, and then if not, like they get a little bit, I think they're good. They're a little bit confusing and out of the scope of this show. Or what ends up happening is people use Medicaid, like they spend through all of their assets, and then their Medicaid kind of takes over and helps pay for that. So you need to have a plan for long-term care because Medicare is not going to cover it at all.
No.
Other than rehab, like you're saying.
Right.
Okay. Anything else you want to add to that?
I don't see a lot of people with long-term care policies these days. In fact, talked to several people who've told me that their long-term care insurance carrier called them and offered them a buyout.
Oh, yeah.
They were being paid $20,000 or $30,000 or $40,000 just to cancel. If you have a long-term care policy, don't cancel it.
Yeah. Well, because you can't get it.
You can't get it back.
They may raise the premium so high that you can't even afford it.
That's why nobody has them, because they cost thousands of dollars a month. You either get it in your 50s or it's cost prohibitive. So they do have financial instruments, annuities with long-term care riders. Okay. I think we have some people here that can talk about that. But generally speaking, if you don't have somebody to care for you in the home, and you don't have a long-term care policy, Medicare will take great care of you, paying the doctors and the providers that are caring for you while you're in a facility. But other than that, you're going to spend $10,000 a month of your assets until your assets are depleted, and then you're going to find yourself on Medicaid, maybe moving to a less desirable facility, but you won't be on the street. You'll just be on Medicaid till the end.
Okay, that's number 2. Let's talk about number 3, which is kind of like 3 and 4. We're going to toss in a little bit here. So Medicare is not going to cover really dental things other than medically, like my understanding is like you have a wreck, your jaw gets busted up. They're going to reconstruct that.
That's right.
If you have, like your kidney transplant, there's, I guess, a lot of things that are orally that go along with that. So they can do some stuff as it relates to that. But generally speaking, dental isn't really a part of Medicare.
It's not. Not in the sense that people think of dental insurance, where I'm taking it to go to my dentist, I got a crown or I got a cavity or something like that. No, Medicare doesn't cover your teeth. We don't know why. We think maybe in the 1960s, did nobody have their teeth at 65?
Nobody cared about their teeth?
Nobody cared. I don't know. You could talk to the Congress in 1965. But there's no dental in Medicare. If you want it, you've got to get it separately with your supplement plan, or you can find an Advantage plan that'll have some of it in there.
And the Advantage plans, when they cover dental, it seems to be more like not a true dental plan. It's like a dental allowance, like they're going to cover, I don't know. Speak to that.
Yeah, and not as much as you hope. Either. We've seen
it used to be more.
It did.
Yeah, but that has dropped back a lot lately.
Yeah, it seems like $1,000, even $500. There's a lot of plans that are offering just preventive dental only in the Advantage plan, unless you pay a $44 or $55 monthly premium to add it. Before you do that, talk to us. We've got some really good dental options outside of Advantage plans that are traditional, actual dental insurance.
So let's speak to that for a little bit. So if you are on Medicare and you don't have dental insurance, let's talk people through kind of like maybe your favorite option. You help people with this all the time.
Yeah, I do all the time. A lot of my clients, have dental insurance while they're working, and they want to have dental insurance when they're not working anymore. Sure. So we have several different carriers that we use. I have one that I use more than the others. I like it. I find that it hardly ever gets canceled, which tells me it's
a good indicator.
Probably the best thing I've got for dental insurance. It's available in most of the country, and we can certainly talk to people individually. But if you have dental insurance while you're working, you want to get dental insurance within 60 days of leaving that job so that you have a continuation of your dental benefits and you're not starting off with a new waiting period. So if you want it, get it at the right time.
Yeah. So let's talk about waiting periods for a minute, because people have heard of that. So there's this concept called CPC, which means continuation of prior coverage. Mm-hmm. So to Justin's point, like if you're coming off of employer coverage, you've got dental coverage, get new coverage within 60 days. Not all plans offer this continuation of prior or continuous prior coverage, whatever, or credit for prior coverage. But some do. We've got some options that do. That way there's no waiting period. So what's a waiting period?
Well, that's where you sign up for dental insurance not having had it because now something hurts.
Yeah.
So I've got to go to the dentist. So I'm going to buy dental insurance. And so they're going to tell you, well, for the first 12 months, we're not paying 50% of your major dental work. We'll pay 10 or 20.
Yeah.
Will help. But this happens because dental insurance is outside of Medicare and can be purchased 365 days a year.
And if you think about it, it makes sense, right?
Yeah.
Something hurts. The dental, like, we'll sell you dental insurance. We're just not going to pay much for a little while. Right. Because if not, everyone would get it when something hurts, use it, and cancel it the next month.
And the industry would not survive.
All dental plans would be like $250 a month. Yeah. Instead of $35, $40.
So the CPC says that if you are getting a new dental policy within 2 months of canceling or leaving the old one, they'll give you credit for those last 12 months already spent.
Right, so then you skip that waiting period.
And you skip the waiting period, and it's just like you've been there for a year.
And so with dental insurance, there's usually there's like preventive, which we all know is cleanings, maybe x-rays, and there's basic services, which are fillings and
simple extractions.
Yeah, simple extractions, and then there's major.
Right.
Which is like bridges and crowns and all that sort of stuff.
All the
right?
big stuff.
So the way those dental plans usually work is all of them pretty much cover preventive, the cleanings, the x-rays, right? 100%. Maybe you've got a small copay or a small deductible for the year. But then after that, then you have a cost sharing for anything basic or major. Right. And so it generally caps out to be about 50-50, meaning the dental plan will pay 50% of the cost. You'll pay 50% of the cost. That's on the major things. And I think on basic, which is filling simple extractions, more like 80-20.
More like 80-20. They'll cover 80%.
And then the dental plan sets an annual max, and that can be anywhere from $1,000 to, I think we've got some plans that are $10,000. So
we have one granddaddy dental plan with a $10,000 benefit. It's massive. $3,500 is even considered big.
Yeah. Yeah.
Yeah, so you can expect at least from my favorite dental insurance carrier, you can expect 100% coverage for your twice-a-year sit-downs, no deductible, no copay, literally no charge to sit in the chair. Okay. Some of the plans will pay for themselves just by covering that. But then if you need a filling or an extraction is going to be covered at 80%. You can expect a $50 deductible and 20% of the cost, so it's going to be cheap to get a filling. When the major stuff happens, crowns, root canals, dentures, bridges, implants, you're going to pay $50, and they're going to pay 50% up to $1,500, $2,500, $3,500.
Whatever max you've chosen.
Right.
Guys, if you need help getting dental coverage set up, call our office. That phone number is 833-833-3661. We can compare all those options. We've got a lot of different options depending on your needs, your dental health, your budget, how much you want to spend, how much coverage you have. So 833-833-3661. We'd love to help you compare that. Because Medicare doesn't cover it. And so you need to have coverage. It's interesting, we've probably all seen some of these reports about kind of how dental things can impact your health. My mom had a situation where she had a tooth that needed to get extracted. For some reason, didn't get it extracted. Caused an infection that went down and then triggered an autoimmune disorder flare-up. Was in the hospital for 3 months. Wow. I mean, like the taking care of your dental health is very important. It covers a lot. It's not just how good your smile looks. It can affect so much more than that. And so take care of yourself as we all age when it comes to our dental stuff. Okay, we've got some callers. Let's hop to those. Hello, Mike. Are you there?
Yeah.
Hey, tell us your question, sir.
You probably recognize this draw. But in either case, I'm trying to help a friend, makes her, or at least provide her with information that so she can make decisions.
Okay.
She lives in Louisiana.
Louisiana, okay.
She's 65, and she'll be 66 in December.
Okay.
Okay, so it's about the earnings test. Ultimately, she's wanting to get that Social Security rolling sometime this year.
Okay.
And since she'll be 66 before January, my first question would be, does she have the full year of what's left of this year if she was to start in July or August? Does she have the entire last 5 or 6 months in that example to make the full 24,000 after it starts rolling before the end of the year, or do they force the monthly $2,040?
Yeah, they're gonna
be used.
They're gonna look at the monthly there. So since she's taking, because
Okay.
her full retirement age is 67, so next year, right? If we were talking a year in the future, that amount has become 65,000, right? 160. But for this year, it's 24,480, and whenever she takes, they will then kind of apply that monthly amount. And so if she were to take in July or August, then she needs to stay below that monthly amount.
Okay, so she would not, in effect, have 24,480 allowed while taking this year.
Well, you could look. I mean, you could look at it a few different ways. It could actually be more. I mean, she is not taking Social Security right now, so she could make 50,000 in the first 6 months of the year, right? But then they're going to, when she does take, they're going to look at it and say, okay, if she's, they're going to look backwards and they're going to look forward. So does she work right now? I'm assuming she does.
Yes.
Do you know how much money she makes every month ish?
No, I really don't.
Okay. So let's say she was making $1,000 a month. Okay, and this is my understanding of how it works. Let's say right now she's making $1,000 a month for some reason. So for the first 6 months she made $6,000, right? So they're going to give her the best of not both worlds, but the benefit, I guess. So we take 24,000 minus 6,000, so she could make 18,000, right, in the last 6 months. So 18 divided by 6 is, what is that?
3.
Yeah, 3,000. Right, so she could actually make more than the 2,000. So they're going to look back. They're going to say, okay, how much have she made? But let's say she's already made 24,000 in the first 6 months, right? They're going to say, okay, well, let's use the monthly amount going forward for the rest of the year. And so we're going to take 24,480 and divide that by 12. And now she needs to stick within that, about $2,000 a month for the rest of the year. Does that make sense? They're kind of going to look back. They're going to look forward. And whichever one best benefits her is the one it's going to go with.
Well,
I
was understanding the rule to be that only while she's taking does this year matter. Which is 24,000. So they would possibly make the difference of whether or not she continues to work, and she wants to.
She wants to continue to work.
I mean,
she wants to.
I
do know she makes more than $1,000 a month, but I don't really know
how much.
Let me make sure I've got this straight. So she's 65 now. She's turning 66 this December, and she's going to be, which means she's going to be 67 next December, right? That's her full retirement age, is 67.
Right.
The calendar year in which she reaches 67 years old, it's no longer 24,480, it's 65,160. Josh said this a little bit earlier.
Right. Well, this year is the one that matters.
If she were to take it
It's the one
this
that's gonna.
year, if she's taking it June or July of this year is what you're asking. Okay.
Yeah, sometime probably late summer, but worst case would be, I say worst case test-wise, would probably be July.
Well-
But, or later. And so I'm led to believe that she makes more than $2,040 a month.
She may not be able to get the full
So
benefit even drawing it this year. Here's one thing, Mike. You can try and figure this out for her, and you're a good friend for wanting to. But in reality, if she wants to apply or even thinks she may want to draw Social Security, encourage her to do the application online at the Social Security website, because that doesn't automatically turn it on. You're just telling her to fill out the application as if she intends to start it. And it's going to result in a phone call with a Social Security agent. It always does. And they're going to ask her what her income
and
is.
that's already happened. And because they only wanted to look at the monthly amount for the rest of the year,
They
she's
told her
gonna
she
get
couldn't
penalized.
take it. Yeah.
Yeah. Well, then that's the case.
Well, they didn't tell her she couldn't. They just said, yeah, you're going to end up with an earnings test penalty, even though you're going to earn less than $24,000 the rest of the year. And I thought it only mattered while you were taking. And,
Yeah.
you understand my dilemma trying to help her answer this question.
Not
So,
well, maybe not really. So she had an appointment, and they said, "Hey, you're going to be subject to the earnings test because she's going to make over the amount."
Mm-hmm.
And so they're going to withhold probably. Did they say how many Social Security checks?
No, they didn't. She didn't tell me. She just told me about the phone call when they contacted her.
Why don't you do this? We'd love to chat. Maybe call in next week or call in here in a couple of days. So if you want to get a little more info,
right.
we'd love to chat a little bit more about this here in the next couple of days. Okay.
Thanks, Mike.
Thanks, Mike. Take care.
Thank you.
Bye-bye. Hello, Wilma. Welcome to Medicare School Daily. What's your question?
Hi.
Hi.
My question this morning is, how does Medicare or Medicaid, the two combined, affect my estate in the event of my death concerning my heirs or the transfer on deed? Is that how it goes?
Transfer on death?
Transfer on death deed, yeah.
Okay. Can you give me a little more context? Because I want to track with you. So.
Okay. Well, explain to me how.
Well, how does, I mean, once you're gone, are you talking about
once I've
bills
passed.
or, okay.
No, I'm property. Owned property.
And how does Medicare affect that?
Yeah, Medicare and Medicaid. I understand that when you have Medicaid also on with your Medicare, that if you've had it within the last 5 years, I think, that they can keep some of your assets or something. Am I correct in that assumption or not?
Medicaid in many states has provisions to recover the benefits that they paid to you through your estate when you pass. And you can try and protect assets from this by moving them into a deed or a trust, but you got to do that 5 years before you pass. Otherwise, they'll look back and claim that asset.
I see.
So
I see.
it is more of a tax preparer's question
legal
about
estate planning attorney.
how to protect my estate is a question for somebody other than me.
And Minnesota is, I mean, there's going to be some different rules in that.
Montana.
So, sorry, I saw MN. So you're in Montana. Okay. So I would say if there's like a local estate planning attorney or something like that, talk to them about, hey, if this is going to be an issue down the road, how can you get your stuff titled or moved in such a way that they don't come back after that? So I wouldn't want to give you the wrong advice for Montana and mess you up down the road. Okay. yeah,
I
for sure.
understand.
Any other
Thank
questions?
Gosh, not right off the top of my head.
Okay, sounds good. Thanks, Wilma.
Thanks, Wilma.
Take care.
Thank you. Bye-bye.
So this is a situation where somebody has Medicare is really irrelevant in this. Like maybe Medicare is part of it, but maybe they went into a long-term care facility, custodial care, whatever, and there was a lot of money that was spent. And so Medicaid is wanting to recover some of that, and so they can go after the assets. Is that right?
They can, and they will. I think certain states allow that, and probably others don't. But generally speaking, Medicaid is not just free.
Yeah.
They're going to want to recuperate as much as they can from your assets when
So that's
you're
why
gone.
there's things like spend downs that happen while you're alive, but I guess even after the fact, they can come back and put a claim on those assets, unless you probably work with an estate planning attorney, shift things around, try to get stuff out of your name, but it has to be done 5 years in advance. So it can't be like the family goes, oh, Medicaid, let's get everything out of her name.
Yeah.
They're going to
No,
come after it.
It's too late. I mean, if you think about it, Medicaid is a social services program to protect the most vulnerable and, they're near the poverty limit. So it's not usually a question of trying to protect a whole lot of assets.
Yeah.
But if somebody has a home, they have, assets, and then they go to the way of Medicaid because of the expenses of long-term care, then, they can expect that Medicaid is going to get theirs back when you don't need that place anymore. And the family can't have the house, maybe.
I wish money was free.
Oh, yes.
It would be nice. Okay, guys. Hey, tomorrow's show, we're going to talk. We got a question on one of our channels about, hey, you guys talk about Medicare supplements a lot and what they cost at 65, right? But what does it look like at 70? What does it look like at 75? What does it look like at 80? And so on tomorrow's show, we're going to talk all about that. We'll run some quotes. We'll run some prices around the country. Kind of talk about how prices have been going up and then what you can expect as you get into some of your later years. So, guys, if you need help on Medicare, Justin is one of our agents here, licensed in all 50 states. We've got a bunch of other folks just like him, probably none quite as good, though.
Or handsome.
Or handsome. And so if you want help from us or from Justin even, call in. Our phone number, our office number is 833-833-3661. We would love to help you. We can help you enroll in Medicare A and B. We can help you enroll in Medicare supplement plans, Medicare Advantage plans, drug plans, prescription plans, whatever it is. But really just look at your situation, financial health, what you want for insurance, and kind of limit all those options down or filter those options down to true recommendations that will work for you. And so call in. We'd love to help you. And our services are free. We're insurance brokers. We do not work for free, but we are paid by all those insurance companies that are filling up your mailbox. So if we can help, call us. Guys, if you want to be a part of the show tomorrow, 833-824-2004. The phone number's at the bottom of the screen. We'd love to talk with you, get your questions answered, and learn from you as what you're experiencing in Medicare. Cheers.